Some lives are not ended by fate, but by paperwork signed too quickly. The room inside Harborview Animal Medical Center in Maryland is quiet in the way only sterile places can be quiet, where even breathing feels regulated, measured, controlled. A white German shepherd lies on a steel examination table under soft fluorescent light that hums faintly above him. His coat unusually pale, like winter frost against metal, his chest rising slowly, unevenly, as if each breath has to be negotiated rather than given freely. A small identification tag rests near his front paw, but the information on it is incomplete, smudged by time and weather, leaving more questions than answers. Across the room, Dr. Emily Carter stands still for a moment longer than protocol allows, her eyes not on the paperwork in her hands, but on the animal in front of her, as if something about him refuses to align with the categories stamped across his file. The file reads in plain administrative language, unidentified K9. Intake, stray. Status, behavioral risk. Recommendation, humane euthanasia. The words feel heavier than ink should ever feel. Near the door, Officer Daniel Reeves adjusts his stance, arms crossed, his tone steady but detached in the way professionals learn to protect themselves. We've held him as long as policy allows, he says quietly, glancing at his watch. No chip response from standard scan. No registration match. No active handler report. We can't keep resources tied up on a stray that may be unstable. The word stray hangs in the air longer than anything else. Ghost does not react to the voices the way an unstable animal might. He does not bark, does not pull against restraints, does not show aggression. Instead, his eyes track movement with a calm precision that feels almost human, as if he is listening more than seeing, waiting more than reacting. Dr. Carter steps closer, her hand hovering near the scanner wand, hesitating for a fraction of a second that no one else seems to notice. He's not behaving like a stray, she says softly, more to herself than to anyone else. Reeves exhales through his nose, a quiet sign of impatience. Behavior doesn't override protocol. The scanner is activated. A faint electronic tone fills the room as the device passes over Ghost's shoulder area where the microchip should be. A green light pulses once, then flickers, then returns an error code. No match. No identity. No history. Just silence from the system. Dr. Carter lowers the device slowly, her brow tightening. Something about the failure doesn't feel like absence. It feels like resistance. Ghost shifts his head slightly, not toward the machine, but toward her, as if acknowledging that she is the only variable in the room that has not yet decided what he is. Outside the small observation window, hospital corridors continue their indifferent rhythm, footsteps passing, phones ringing, lives continuing in parallel indifference to the decision being made behind glass. Reeves clears his throat again. Dr. Carter, we proceed in 10 minutes unless you have a valid reason to delay. 10 minutes. The number lands between them like a sealed verdict. Dr. Carter looks down at the file again, then back at Ghost. His fur is clean in a way that does not match abandonment, his posture too controlled for a discarded animal, his eyes carrying something unspoken, something orderly beneath the silence. She notices the faint scar along his shoulder, old, healed, not random. Military-grade marking, perhaps, or training-related, but not the kind a stray should carry. Run it again, she says suddenly. Reeves raises an eyebrow. We already did. Not the standard scan, she replies, her voice quieter now, but firmer. Use the extended registry, the one reserved for classified K9 identification profiles. A brief pause follows. That level of access is not routine, not encouraged, and certainly not used for cases already marked for termination. Reeves hesitates, then exhales and steps aside. Dr. Carter connects the device manually to the secondary terminal. The screen flickers, older interface lines appearing, systems rarely touched in years. Ghost remains still as the scanner passes over him again. But something subtle changes in the room, not in him, but in the atmosphere around him, as if the air itself is waiting. The machine pauses, then begins to process. And for the first time since he arrived, the silence feels like it is holding its breath. The faint electronic hum of the terminal fills the room as the extended registry begins its search. And for a moment nothing happens, only a slow blinking cursor that feels almost uncertain, as if the system itself is hesitant to open something that was meant to stay closed. Dr. Emily Carter leans slightly forward, her hands resting near the edge of the console, her eyes fixed on the screen with a focus that is no longer procedural but personal. Officer Daniel Reeves stands a few feet behind her, arms still crossed, but his posture has shifted in a subtle way, less impatient now, more observant, as if even he can sense the room changing its temperature without any physical cause. Ghost remains motionless on the steel table, his head slightly angled toward the sound of the machine, not frightened, not reactive, simply aware in a way that feels trained rather than instinctive. The air conditioning vents above release a soft, steady stream of cool air that brushes through the sterile room, carrying the faint scent of antiseptic and metal. Then the screen flickers once, sharply, and the cursor stops blinking. A single line appears, then another, each one loading slower than the last, as though the system is retrieving something buried beneath multiple layers of restricted classification. Dr. Carter reads the first line silently, her expression tightening just slightly. Then she reads it again, this time under her breath. K9 designation confirmed, she says softly. Reeves straightens, almost imperceptibly. The system continues. A second line resolves. Unit classification, Special Reconnaissance K9 Program. The room feels different after those words, as if the label itself carries weight beyond its meaning. Dr. Carter's eyes do not leave the screen. That is not standard field deployment, she murmurs. Reeves steps closer now, no longer staying near the door. That program was decommissioned years ago, he says, though his tone suggests he is no longer fully certain of what he is saying. The screen continues to populate. Ghost shifts his front paw slightly on the examination table, the faint sound of metal against metal echoing softly in the quiet room. Dr. Carter clicks forward. Another line appears. Active Handler Association, Lieutenant Marcus Hale. The name lands in the room like a distant memory being pulled forward into the present. For a brief moment, neither human speaks. Even Reeves seems to pause at the familiarity of it, though he cannot immediately place why. Dr. Carter scrolls further. The file expands slowly, revealing segments of operational history, fragmented mission logs, and incomplete retrieval records marked under Emergency Classification Review. Last confirmed deployment, she reads quietly, 17 months ago, Northern Operational Corridor. She stops again, her eyes narrowing slightly. No formal decommission order was ever finalized. That statement changes the tone in the room entirely. Reeves looks at the screen more closely now, his skepticism replaced with something closer to concern. If he is still active in the system, he says slowly, then he was never supposed to be here. Dr. Carter does not respond immediately. Instead, she turns her gaze back to Ghost. The white German shepherd meets her eyes again, steady and calm, his expression unchanged, as if he has heard this before, as if names and classifications are only echoes of something he already knows but cannot speak. She reaches for the scanner again, not to confirm identity this time, but to verify something deeper. The device passes over him once more, slower, more deliberate. The system responds instantly this time. No delay, no error. A full profile begins to load, and the screen brightens slightly, as if acknowledging authority. Officer Reeves leans in enough now that his voice lowers instinctively. Doctor, what does it say? Dr. Carter reads the first visible line and pauses again, her breath catching just slightly before she speaks. It is not a stray, she says quietly. The words feel heavier than the room itself. Ghost shifts his head a fraction toward her, as if acknowledging the correction without needing to understand the language. The file continues to resolve behind her eyes, but she does not speak the rest yet. Instead, she stares at the screen, realizing that what they were preparing to end was never just an unidentified animal, and that somewhere beyond the sterile walls of the medical center, a history was waiting to be remembered rather than erased. The moment the words settle on the screen, the room feels quieter in a way that is not caused by sound, but by realization. Dr. Emily Carter remains still, her eyes scanning the final lines of the loaded profile as if repetition might change its meaning or reveal something previously hidden. Officer Daniel Reeves no longer stands with the same rigid posture as before. His arms have lowered slightly, and for the first time since entering the room, he is not looking at procedure or policy. but at the screen as though it represents something larger than both. Ghost remains on the examination table, his breathing slow and steady, his head angled toward Dr. Carter as if he is observing her more than the machine that now defines his identity in official terms. The terminal emits a soft confirmation tone, signaling that the full classification has completed loading. Dr. Carter scrolls carefully, her finger hesitating just above the interface before continuing downward. Each line appears with deliberate pacing, revealing operational history that feels distant yet precise, as though it belongs to another world operating parallel to the one they currently occupy. Multiple field deployments confirmed. She reads softly, her voice controlled but no longer clinical. Special reconnaissance operations in high-risk terrain environments. She pauses, absorbing the structure of the language, noticing how carefully the system avoids emotional phrasing, reducing experience into sterile classification. Reeves steps closer again, now clearly reading over her shoulder. "This is not a civilian animal record," he says quietly, as if stating it aloud makes it more real. Dr. Carter does not respond immediately. Instead, she continues. "Handler continuity confirmed across multiple assignments," she reads. "Primary attachment established with Lieutenant Marcus Hale." The name appears again, but this time it carries context. The system expands a secondary file window, revealing mission markers and timestamps, all structured in precise military formatting. One entry catches her attention longer than the others. Last joint operation status. Compromised communication window. Extraction unit failure. Subject unaccounted for following mission disruption. The phrasing is careful, but the implication is clear. Reeves exhales slowly, his eyes narrowing. Unaccounted for does not mean abandoned, he says, more to himself than to her. Dr. Carter finally looks away from the screen and turns her gaze toward Ghost again. The white German shepherd remains still, but something in his expression feels different now, not changed, but understood differently. He is no longer just a patient on a table awaiting a decision. He is a record of something unfinished. The scanner on the counter emits a faint pulse, indicating that the identification sequence is still active. Dr. Carter initiates one final cross-reference, bypassing the default medical database and connecting instead to archived military retrieval logs. The system hesitates briefly before responding. A red indicator flashes once, then turns green, granting access. The room feels smaller as the screen shifts. A new file opens, labeled under Restricted Operational History. Dr. Carter reads the first visible line and stops speaking entirely for a moment. Reeves notices her silence immediately. "What is it?" he asks. She does not answer right away. Instead, she scrolls further down, her eyes tightening slightly as she processes what she is seeing. Then she speaks, her voice lower than before. "This K9 was part of a unit that never returned from final extraction protocol." The sentence is simple, but it alters the atmosphere of the room entirely. Ghost lifts his head slightly at the sound of her voice, not reacting with alarm, but with quiet attention, as if the words carry meaning he already carries but cannot communicate. Dr. Carter steps back from the terminal, her hand still resting lightly on the edge of the console. The euthanasia authorization form remains open on a separate screen, unchanged, waiting for confirmation that now feels increasingly disconnected from what they have just learned. Reeves looks between the screen and Ghost, his expression no longer certain. "If that record is accurate," he says slowly, "then someone is still out there looking for him." Dr. Carter nods faintly, though her eyes remain fixed on the dog. The sterile light above hums softly, but the sound now feels distant, almost irrelevant. Ghost shifts his weight slightly on the examination table, his posture steady, grounded, as if the conversation is not about his existence, but about his return to something unfinished beyond these walls. The system emits one final tone, indicating completion of identity confirmation. On the screen, a single line remains visible beneath the classified header. Status recommendation pending command review. Dr. Carter closes her eyes briefly, then opens them again, as if making a decision that does not belong to policy. "Cancel all termination procedures," she says quietly. Reeves does not immediately respond. He simply looks at her, then at the screen, then back at Ghost. And for the first time since this process began, no one in the room reaches for a form or a signature. The silence that follows Dr. Emily Carter's decision feels heavier than any spoken instruction in the room. The words she has just said do not echo loudly, but they change the atmosphere completely, as if the entire medical space has been redefined by a single reversal of intent. Officer Daniel Reeves remains still for a moment longer, his eyes fixed on the screen displaying the final status line. The administrative system continues to blink softly, waiting for confirmation that will now never come. Ghost, the white German shepherd, remains on the examination table, his posture unchanged, but his attention subtly shifts toward Dr. Carter, as if he recognizes a shift in direction even without understanding the language of policy or authorization. Dr. Carter exhales slowly and steps back from the terminal, her hand still hovering near the edge of the console before she fully withdraws it. "We are not proceeding," she says again, this time with finality that carries no uncertainty. Reeves turns slightly toward her, his expression caught between protocol and something more human. "That decision places responsibility on you," he replies quietly. She nods once, acknowledging the weight of it without hesitation. The room feels different now, not because anything visible has changed, but because the trajectory of what was about to happen has been interrupted. Ghost lowers his head slightly, resting it closer to the table, his breathing steady but no longer measured against an endpoint. Dr. Carter walks slowly toward him, her movements no longer procedural. She stops at the side of the table, looking directly at him for several seconds without speaking. The white fur along his neck catches the soft fluorescent light, giving him an almost unreal appearance, as if he belongs to something beyond the clinical setting surrounding them. "He is not lost," she says quietly, more to herself than to Reeves. Reeves does not respond immediately. Instead, he turns back to the terminal, reviewing the classified profile still open on the screen. "Lieutenant Marcus Hale," he reads again under his breath, as if the repetition might unlock a memory. That name is tied to multiple unresolved field operations. Dr. Carter watches him now. "Then we are not dealing with an abandoned animal," she says. "We are dealing with a separation that was never officially closed." The phrase lingers. Ghost shifts slightly on the table, his ears angling toward the sound of her voice, as if recognizing tone more than words. Reeves finally lowers his arms from their crossed position. "If that is true," he says slowly, "then there may be active recovery protocols somewhere in the system that were never completed." Dr. Carter returns to the terminal, navigating deeper into the archive with deliberate precision. The interface responds more slowly now, as if accessing older layers of information that have not been touched in years. A secondary file opens, marked under conditional retrieval status. She reads carefully, her expression tightening slightly as she progresses through each line. "Canine unit designated for high-risk reconnaissance," she says softly. "Attachment protocol established for mission continuity under extreme conditions." She pauses again, then continues. "Final entry indicates separation during emergency extraction window." Reeves leans closer. "Does it indicate outcome?" Dr. Carter scans further down. The system hesitates briefly before displaying a final note. "Handler status, unresolved." The words settle into the room with a weight that no one interrupts. Ghost lifts his head slightly at that moment, his eyes shifting between the two humans as if sensing that something about his existence has just been acknowledged in a way that changes its meaning. Dr. Carter steps back from the screen, her gaze now fully on him again. "He was not discarded," she says quietly. "He was left in a system that never completed its final record." Reeves exhales slowly, his stance no longer rigid. "Which means," he says, "someone out there may still believe he is active." The idea shifts the tone of the room again, not toward urgency, but toward uncertainty. Dr. Carter nods faintly. Ghost remains still, but his attention is no longer passive. It is focused, as if the mention of an unseen connection has reached him in a way no scanner ever could. The terminal emits a soft notification tone, indicating that administrative override options remain available, but neither of them moves to engage it. Instead, there is a pause, a shared silence that feels less like hesitation and more like recognition that what they are holding is not simply data, but continuity. Dr. Carter finally speaks again, her voice calm but firm. "No termination," she says. Reeves does not object this time. He simply nods once, acknowledging the shift without resistance. Ghost shifts his weight slightly, his posture easing for the first time since he arrived in the room. Outside the sterile walls, life in the hospital continues unchanged, but inside, the decision has already rewritten everything that was supposed to happen next. The room remains still in the aftermath of the decision, but stillness in a place like Harborview Animal Medical Center is never truly empty. It is filled with the subtle sounds of systems continuing their work, air vents cycling filtered air, distant footsteps moving through hallways beyond closed doors. Dr. Emily Carter stands beside the examination table, her attention fixed on Ghost, the white German shepherd whose presence now feels less like a case file and more like an unresolved story. Officer Daniel Reeves has stepped slightly away from the terminal, his posture no longer rigid, his focus divided between the screen and the animal on the table. The classified profile remains open, its lines of text unchanged, as if waiting for a continuation that no longer follows protocol. Ghost shifts his head slightly, his eyes tracking Dr. Carter as she moves closer. There is no urgency in his movement, no resistance, only a quiet awareness that the environment around him has changed in a way that affects his future without him needing to understand why. Dr. Carter gently removes the scanner from the console and sets it aside, her actions slower now, no longer dictated by procedure. "We stabilize him first," she says quietly, more as a confirmation of intent than instruction. Reeves nods once. "Medical stabilization overrides administrative classification," he replies, as if reminding himself as much as her. The words feel formal, but the tone behind them has softened. Ghost remains calm as Dr. Carter checks his vitals, her hands precise but no longer detached. The rhythmic sound of the monitor provides a steady background pulse, confirming that despite everything, his condition is not defined by the system that almost ended the process. She adjusts the examination light slightly, lowering its intensity so it no longer feels harsh. "He is responsive," she notes softly. Reeves observes from a short distance now, his arms no longer crossed. "He has been responsive since intake," he says, almost as if realizing it only now carries meaning. Dr. Carter glances at him briefly before returning her attention to Ghost. "But not in the way they expected," she replies. There is a pause as she gently runs a handheld diagnostic tool near his shoulder, observing subtle readings that now matter more than classification. The system still displays the unresolved handler association, but it is no longer the focus of the room. What matters now is the living presence in front of them, not the unresolved administrative label attached to him. Ghost shifts slightly, his ears turning toward the soft mechanical sounds of the equipment, then back to Dr. Carter. There is a steadiness in his gaze that feels intentional, as if he is measuring the environment with familiarity that does not belong to a stray or an abandoned animal. Reeves takes a slow step closer. "If his handler is still active somewhere," he says quietly, "then this may not end here." Dr. Carter nods slightly, not taking her eyes off Ghost. "Then we will not treat it as an ending," she replies. The monitor emits a steady tone, uninterrupted, confirming stability. Dr. Carter reviews a secondary diagnostic report on the handheld device. The readings confirm controlled respiration, stable heart rhythm, and no immediate distress indicators. The earlier decision to halt euthanasia is now fully reflected in the system status, marked as medical continuation pending further evaluation. She places the device down carefully and looks at Ghost again. "You were never meant to be defined by a single file," she says softly, not expecting a response. Ghost blinks slowly, remaining still. Reeves exhales, his attention now fully shifted away from the terminal. The classified screen remains open behind him, but it no longer dictates the atmosphere of the room. "What happens now?" he asks quietly. Dr. Carter pauses for a moment, then answers with calm certainty. "Now we give him time." The phrase feels simple, but in the sterile environment, it carries weight. Time is no longer an administrative constraint or a procedural delay. It becomes the only thing that matters. Ghost lowers his head slightly, resting it closer to the table again, not in surrender, but in calm acceptance of the moment. The fluorescent light above continues its steady hum, but the room no longer feels like it is waiting for an ending. Instead, it feels like something paused, held in suspension between what was decided and what is yet to be discovered. The hospital room feels different now, not because anything visible has changed, but because its purpose has shifted from resolution to observation. Dr. Emily Carter stands near the examination table, her attention no longer divided between systems and decisions, but fully present with the living subject in front of her. Ghost remains calm, his white coat catching the soft fluorescent light, his breathing steady and unhurried. Officer Daniel Reeves is no longer positioned near the terminal. Instead, he stands a few feet away from the table, his posture relaxed compared to earlier, though his attention remains sharp. The classified screen behind him still displays fragmented data, but it is no longer the center of gravity in the room. Dr. Carter gently adjusts the positioning of the monitoring leads on Ghost's chest, her movements careful and deliberate. Vital stability is improving, she says softly, more as confirmation than analysis. Reeves nods, watching the display on the monitor. He is adapting faster than expected, he replies. Ghost shifts slightly, his head turning toward Dr. Carter as she speaks, as if tracking her voice more than her movements. There is no tension in his posture, only a quiet alertness that feels structured, almost disciplined. Dr. Carter takes a slow breath, then looks toward Reeves. We need to consider what happens beyond stabilization, she says. Reeves raises his eyes slightly. You mean long-term care? She nods. And possible reintegration. The word lingers briefly, carrying implications neither of them fully elaborate on. Ghost remains still as they speak, but his eyes move between them, attentive in a way that feels less animal instinct and more trained awareness. The monitor emits a soft, steady rhythm, confirming his condition remains stable. Dr. Carter steps slightly away from the table and retrieves a printed diagnostic summary. She scans it briefly before placing it on the counter. There is no indication of trauma that would justify behavioral classification as dangerous, she states. Reeves responds quietly, which means the original designation was incomplete. Dr. Carter looks at him for a moment. Or incorrect, she corrects gently. A brief silence follows. It is not uncomfortable, but reflective. Ghost lowers his head slightly, resting it more comfortably on the padded surface of the table, as if the absence of urgency allows him to settle more fully into his surroundings. Dr. Carter notices the change immediately. He is responding to environment stability, she says. Reeves steps closer again, now observing Ghost directly. Or he is recognizing safety conditions, he adds. Dr. Carter does not disagree. Instead, she adjusts the lighting above the table once more, softening the brightness further. The room becomes less clinical, more neutral, as if it is being adapted for recovery rather than procedure. Ghost exhales slowly, his breathing deeper than before, steady and consistent. Dr. Carter checks the monitoring device again. Heart rate is within normal adaptive range, she confirms. Reeves glances toward the classified terminal still open behind them. What about the record? He asks. Dr. Carter pauses briefly before answering. The record remains incomplete, she says. But incomplete does not mean invalid. The phrase shifts the tone of the room slightly. Ghost turns his head toward the sound of her voice, remaining calm, attentive. Dr. Carter places the diagnostic tool back onto the tray and folds her hands for a moment. Whatever he was part of, she continues quietly, it did not end in a way that this system understands. Reeves looks at Ghost again, his expression thoughtful rather than procedural now. So he is not a stray, he says. Dr. Carter shakes her head slightly. No, she replies. He is a continuation of something that has not been resolved. Ghost remains still, his eyes open, focused, calm. The monitor continues its steady rhythm, and the sterile environment of the room now feels less like a place of conclusion and more like a place of pause. Dr. Carter takes one final look at the system display, then turns it slightly away from direct view. We maintain observation status, she says. Reeves nods without hesitation. Agreed. The decision is no longer contested. It is simply established. Ghost closes his eyes slowly for a brief moment, then opens them again, remaining present, stable, and aware. The room no longer feels like it is deciding what he is. It feels like it is finally beginning to observe who he has always been. The corridor outside the medical observation room is quiet, but not empty. The faint echo of rolling carts and distant intercom announcements drifts through the hallway, blending into the controlled rhythm of Harborview Animal Medical Center. Inside the room, Dr. Emily Carter stands beside the examination table, her attention still centered on Ghost, the white German shepherd whose presence has shifted from uncertainty to something more stable, more defined in its calmness. Officer Daniel Reeves leans against the counter near the diagnostic station, no longer monitoring the classified terminal, which now sits dimmed in the background like a closed chapter that is no longer driving decisions. Ghost remains still, but his eyes are open, tracking subtle movement in the room, especially Dr. Carter, who moves with measured calm as she reviews updated observation notes. His vitals have remained consistent for over 40 minutes, she says softly, more as a confirmation than a report. Reeves nods. That level of stabilization after initial intake is uncommon, he replies. Dr. Carter glances at him briefly. It suggests he is not reacting to stress in the way an untrained or abandoned animal would. Ghost shifts slightly, adjusting his position on the padded surface, his breathing steady and controlled. There is no sign of agitation, only awareness, as if he is gradually accepting the environment as non-threatening. Dr. Carter steps closer and gently adjusts the sensor line once more, ensuring clean contact with the monitoring equipment. The soft beeping rhythm continues unchanged. We should consider behavioral evaluation under controlled conditions, she says. Reeves watches Ghost closely. You think he can be assessed for operational readiness? Dr. Carter pauses for a moment before answering. I think we do not yet understand what he was trained to do. The statement lingers in the room, not as speculation, but as acknowledgement of missing context. Ghost's head tilts slightly toward her voice, responding not to command, but to tone. Reeves shifts his weight. If his classification is what the system suggests, then he was part of something structured, he says. Dr. Carter nods slowly, which means his behavior is not random. It is learned. A brief silence follows. The medical equipment continues its steady cycle of readings, reinforcing stability rather than urgency. Dr. Carter looks down at the printed file summary again, then places it aside. We are no longer treating this as a terminal case, she says. Reeves responds without hesitation. Agreed. Ghost lowers his head slightly, resting more fully now, not in withdrawal, but in comfort. The tension that once filled his posture has softened, replaced by quiet presence. Dr. Carter observes this carefully. He is adapting to trust cues, she notes. Reeves raises an eyebrow slightly. Or remembering them, he replies. Dr. Carter considers this, then looks back at Ghost. Either way, she says softly, it changes everything about how we proceed. The room remains still for a moment longer, not because of uncertainty, but because the structure of what they are observing no longer fits the assumptions they brought into it. Ghost remains calm, his breathing steady, his body no longer held in anticipation of intervention or judgment. Instead, he exists in a state of continuity, as if the interruption of his previous trajectory has allowed something else to emerge. Dr. Carter steps back slightly from the table, folding her hands. We document this as sustained recovery under observation, she says. Reeves nods once. And we escalate for external review, he adds. Dr. Carter agrees. But not for termination, she clarifies. Reeves meets her gaze briefly. No, he says. Not for termination. Ghost lifts his head slightly at the sound of their voices, not reacting with tension, but with awareness. The sterile lighting above continues its quiet hum, but the room no longer feels defined by procedure. It feels defined by the absence of an ending that was once assumed. Dr. Carter turns slightly toward the door, then back to Ghost. For now, she says softly, he stays here. Reeves does not object. The decision is final in its simplicity. Ghost remains still, but his eyes follow her movement as she steps away, as if acknowledging the continuity of presence rather than separation. The system behind them remains open but inactive, its data no longer dictating action. And in the quiet stability of the room, what once was a conclusion now becomes something else entirely, a beginning that no one had planned for. The observation room remains quiet, but it is no longer the kind of silence shaped by uncertainty. It is the silence of continuity, of a situation that has stabilized into something unfamiliar but no longer threatening. Dr. Emily Carter stands near the edge of the examination table, reviewing the updated monitoring readouts on a handheld device. Officer Daniel Reeves remains nearby, no longer positioned as an authority over the outcome, but as an observer of a process that has already shifted beyond its initial parameters. Ghost lies calmly on the padded surface, his white coat illuminated by soft, diffused lighting that reduces the clinical sharpness of the room. His breathing is steady, measured, and consistent with full physiological stabilization. Dr. Carter scrolls through the updated diagnostic summary again, then pauses. All indicators remain within normal adaptive range, she says quietly. Reeves nods once. He is no longer in a critical state, he replies. Dr. Carter lowers the device slightly. He was never unstable in the way the system initially assumed, she says. Ghost shifts his head slightly, his eyes tracking the sound of her voice. There is no tension in his posture, only awareness and calm responsiveness. The earlier classification that defined him as unknown or high risk now feels disconnected from the reality in front of them. Dr. Carter places the device on the counter and steps closer to the table. Behavioral patterns remain consistent with structured conditioning, she notes. Reeves watches Ghost closely. Military conditioning, he says quietly. Dr. Carter does not confirm or deny immediately. Instead, she observes Ghost's reaction to their presence. He remains composed, attentive, and steady, with no indication of fear or confusion. Whatever his past role was, she says finally, it was not random survival. A soft notification tone from the system briefly draws their attention back toward the terminal. The classified file remains open, but no further updates appear. It is as if the system has reached the limit of what it can reconstruct. Reeves glances at the screen. The record is incomplete, he says again, echoing what has already been established. Dr. Carter nods. But his condition is not incomplete, she replies. Ghost lifts his head slightly, aligning his gaze with Dr. Carter. The movement is subtle but intentional, as if acknowledging presence rather than instruction. The room remains steady, the medical equipment maintaining a quiet rhythm of confirmation rather than alarm. Dr. Carter adjusts the final sensor readings and steps back, crossing her arms loosely. We move him to extended observation, she says. Reeves responds without hesitation. Approved. There is no conflict in the decision now, only alignment. Ghost remains still, his breathing slow and controlled, as the environment around him transitions from acute intervention to sustained monitoring. The sterile lighting above continues its soft hum, but it no longer feels intrusive. It feels like background stability. Dr. Carter looks at Reeves briefly. We will need external coordination if any recovery protocol exists for his original assignment, she says. Reeves nods. If there is anyone still looking, he replies, they will have to be found through classified channels. Ghost shifts slightly, settling deeper into the padded surface, his posture no longer alert for danger, but relaxed within the boundaries of safety. Dr. Carter watches him for a moment longer, then speaks quietly. He is not reacting like something lost, she says. He is reacting like something waiting. The words settle in the room without urgency, but with meaning. Reeves does not respond immediately. Instead, he looks at Ghost again, as if reassessing what waiting might mean in this context. The system terminal behind them remains open, but inactive. No new data appears. No alerts are triggered. It is as if the story has reached a point where the system itself no longer leads. Dr. Carter takes a slow breath. We document stability confirmed, she says. Reeves agrees. And maintain observation status indefinitely. Ghost remains still, eyes open, calm and present. The room no longer feels like it is deciding what to do with him. It feels like it is finally learning how to keep him safe. The observation room has settled into a steady rhythm that no longer feels like uncertainty, but like continuity. The sterile light overhead hums softly, casting a calm, even glow across the examination table where Ghost lies resting. Dr. Emily Carter stands nearby with a posture that is no longer procedural, but attentive in a quieter way, as if she is no longer assessing a case, but respecting a presence. Officer Daniel Reeves remains at a slight distance, his attention divided between the inactive terminal and the living subject who no longer fits any of the original classifications. The classified system remains open in the background, but it has become secondary, almost irrelevant to what is now happening in the room. Ghost lifts his head slightly, his white coat reflecting the soft light, his breathing steady and calm, as if the environment has finally aligned with something familiar rather than foreign. Dr. Carter reviews the final stabilization report on her handheld device and then sets it down without urgency. All readings remain stable, she says quietly. Reeves nods once, his voice measured. He is no longer in any form of critical observation status. Dr. Carter looks at Ghost for a long moment before responding. He was never just a case, she says softly. The words are not dramatic, but they carry weight in the stillness. Ghost shifts slightly, turning his head toward her voice. There is no tension in his body, only presence, as if he is fully aware that the environment around him is no longer threatening or uncertain. The room remains quiet except for the steady rhythm of the monitoring equipment. Dr. Carter steps closer to the table one final time, checking the last of the sensor readings. We maintain long-term observation protocol, she says, more as confirmation than instruction. Reeves agrees without hesitation. And initiate external archival search for classified handler recovery channels, he adds. Dr. Carter nods slightly. If there is a return pathway, she replies, it will not be found in this system alone. Ghost remains still, but his eyes follow their movement, calm and attentive. There is a sense now that his awareness is not tied to fear or confusion, but to recognition of environment and tone. Dr. Carter straightens slowly and takes a step back from the table. The decision that once felt like interruption now feels like alignment. Nothing further needs to be resolved in this moment. Reeves looks at the terminal one last time, then powers down the classified display. The screen fades slowly, leaving only the soft glow of ambient medical lighting in the room. The absence of data feels less like loss and more like closure of a process that was never meant to define what they now understand. Ghost lowers his head gently onto the padded surface, not as surrender, but as rest. His breathing remains steady and even, his body relaxed in a way that suggests acceptance of safety rather than submission. Dr. Carter watches this quietly. He is responding as if he remembers structure, she says. Reeves replies after a moment, or as if structure remembers him. The statement lingers briefly in the air, not as contradiction, but as possibility. Outside the room, the hospital continues its normal operations, but inside, time feels slower, more deliberate. Dr. Carter takes a final note in the record system. Stability confirmed, she writes. No behavioral risk indicators present under current conditions. She pauses, then adds one final line without speaking it aloud. The silence that follows feels complete, not empty. Reeves steps toward the door, but stops briefly, glancing back at Ghost. If someone is still searching for him, he says quietly, this is where they will find what remains. Dr. Carter nods once. Then we are not the end of his story, she replies. Ghost remains still, his eyes open but calm, observing without distress. The light above continues its steady hum, and the room no longer feels like a place of evaluation. It feels like a place of pause between chapters. Reeves exits the room quietly, and Dr. Carter remains for a moment longer, simply observing Ghost in silence. There is no urgency now, no procedural weight. Pressing forward. Only continuity. After a long moment, she turns off the diagnostic panel and steps away from the table. Ghost remains resting, stable and calm, as the observation room settles into a quiet state that no longer belongs to uncertainty or termination, but to something far more enduring, presence without fear, and a future still waiting to be written.